Hi, I'm Dr. Keith Tang, and I'm a family dentist in Irvine, California, in the Westpark community. One of the questions I get asked a lot is, how do I brush and floss my child's teeth when they're not really helpful? I'm going to go ahead and demonstrate that technique for you on this video. Well, one of the things we recommend is lying them down, and that will enable you to get better access to their teeth and limit some of their head movement. To help you demonstrate this, I have my daughter Alyssa here. Say hi, Alyssa.
Hi.
And she's going to be helping us to demonstrate this technique. So, in having a child lie down, you'll limit their head movement. For instance, if she tries to move to the side, I've got this hand that's bracing her head from moving that way. If she tries to move the other side, my body actually limits that movement. And if she, of course, tries to move back, she's already lying flat, so her head's not going to move back. If her hands and her feet are also moving, you may have to have a helper help you. And one of the things you'll want to do is have your helper lie their hands on top of your child's hands, but don't grasp them really tight. Because if you grab them really tight, they're going to feel like something is there to be afraid about. Where instead, what you might want to do is, if they move a little bit, just have them move and actually play with their hands or feet a little bit and just kind of control the movement and keep it out of the mouth area so that the person that's brushing can brush. Okay, so we're going to go ahead and demonstrate that technique for you right now. Let's start with flossing. You want to floss any teeth that touch and that you can't visibly see space between. For most children, that means that you're going to be flossing between their deciduous molars, or their most posterior teeth. I like Glide floss picks. They tend to slip in between the teeth more easily than other brands that I've tried, and the curved shape allows you to rotate into even mouths that are not open very wide. In demonstrating the brushing, I'm using a Braun Professional Care motor with a children's Precision Clean head on it. The technique is the same whether you use a motorized brush or a manual toothbrush. Start with the last tooth and work your way forward. Brush the insides, the chewing surfaces of the teeth, and the outsides of the teeth. If your child isn't opening wide enough, put your finger or thumb behind the last tooth on the gums and push down to get your child to open wider. Smile and nod as they open wider to let them know that that's what you wanted them to do. And if you do it often enough, your child will know that you want them to open really wide when you brush and floss their teeth. Don't be surprised if initially when you start this, your child is not cooperative and comfortable lying back. That's okay, just stick with it. As with any habit, it takes time for both of you to become comfortable with it. And usually by the third or fourth week, most children accept this as part of their normal routine. This is one of the things I recommend to have healthy teeth and gums for a lifetime.